Epilepsy is a neurological disorder in which the brain activity becomes abnormal, causing seizures or periods of unusual behavior, sensations, and sometimes loss of awareness. By the end of this video, you should be able to describe the underlying pathophysiology of epilepsy and seizure, and of course consequently identify the potential pharmacological management for this disorder. Before we move on any further, let us first clarify the definition of epilepsy and seizures. Epilepsy is a chronic neurological disorder characterized by two or more unprovoked seizures. Seizures, on the other hand, are individual occurrences of sudden abnormal electrical activity in the brain. Your brain cells send electrical messages to your body to tell you to move, think, and do things. But when brain cells stop working the way they are supposed to and send too many electrical signals at one time, that's called a seizure, and it's like a giant electrical storm, and these seizures cause a change in how you see, how you move, and what you feel. The signs and symptoms of a seizure are numerous. Someone who is having a seizure might stare into space, they might be fumbling as if they lost something, they could be wandering around like they are lost, their whole body might shake or have uncontrollable jerking movements, or they might say things that don't make sense. To understand about the pathophysiology of epilepsy, it is necessary to know about normal physiology of the brain. In all cells of the body, including the neurons, there is an imbalance in the number of positive and negative ions inside and outside the cell due to differences in rate of permeability of those ions through the cell membrane and sodium-potassium pump. The inside of the cell is about 70 millivolt more negative than outside, which is called the resting membrane potential. Excitable tissue neuron owes their excitability to their ability to transmit changes in resting membrane potential. Conduction of changes in membrane potential in neuron along its axon cause the release of chemical neurotransmitter into synaptic space through which one neuron communicates with another neuron. The primary inhibitory transmitter is GABA or gamma-aminobutyric acid, and the main excitatory transmitter is amino acid glutamate. Excitatory transmitter from excitatory neurons cause an increase in sodium permeability of the next cell membrane and causes slight decrease in resting membrane potential, and this change in membrane potential is called depolarization. Similarly, the release of inhibitory neurotransmitter causes an increase in chloride or potassium permeability and causes hyperpolarization. Normally, the neurons fire in short run, and excitability is controlled by powerful inhibitory influences. And in the normal brain, the action potential firing occurs at different times, meaning it occurs asynchronously, and inhibitory feedback loops regulate the frequency of firing of individual neurons and prevent synchronization. When there is a defect in inhibitory feedback, a large number of cells in a given area of the brain fire at the same time, meaning they synchronize and produce self-regenerating electrical impulse. Two important events involved in seizure development are hyperexcitability, which is the abnormal responsiveness of neurons to an excitatory input leading to multiple discharge, and the other one is hypersynchronicity, which refers to the recruitment of a large number of nearby neurons to an abnormal firing mode. This epilepsy or seizure is a network phenomenon involving the participation of many neurons firing simultaneously, and such an area constitutes or is known as an epileptic focus. What occurs during the seizure is dependent on whether the seizure is partial or generalized, or where in the brain the seizure activity is located. In seizures called focal or partial seizure, this excessive activity begins in one specific area of the brain. The discharge would begin locally and often remains localized, but it can also propagate to other areas of the brain. Seizure is not necessarily manifested by violent involuntary contraction of the muscles or what you usually describe as convulsion. In some cases, seizure can mean experiencing unusual head or eye movement, numbness, tingling, or a feeling that something is crawling on your skin, displaying repetitive movements such as picking at clothes or skin, staring, lip smacking, and chewing or swallowing. Vision changes or hallucination or even mood changes are some of the common signs and symptoms of focal seizures, and this is again dependent on the location where the epileptic focus is. In generalized seizures, excessive activities or excessive electrical activity seems to arise in widespread areas of the brain all at once, affecting both hemispheres of the brain from the beginning of the seizure. Generalized seizures can be classified on whether they are absence seizures, myoclonic seizures, tonic-clonic seizures, and atonic seizure. In most cases, it always involves a loss of consciousness. So to recap, this is what happens during a seizure attack. There could be decrease in inhibitory neurotransmitter activity or a decrease in the inactivation of inhibitory neurotransmitter, or there could be abnormalities in ion channels. All of this will result in an increase in excitatory neurotransmitter activity, leading to a rhythmic and repetitive hypersynchronous discharge of neurons, or rather the development of seizure focus, which causes a seizure attack, which can manifest itself by several signs or symptoms, including staring into space or having abnormal jerky movements, or even something as simple as repetitive movement, smacking your lips and whatnot. Treatment is generally aimed at stabilizing neurons from becoming hyperexcited and prevents excessive impulses to adjacent neurons. Anti-epileptic drugs can work via several mechanisms. First and foremost, through the modulation of voltage-gated ion channel. Some anti-epileptic drugs stabilizes membrane and prevent depolarization. Essentially, it prevents the neurons from becoming hyperexcited and prevent excessive impulses moving to adjacent neurons. Additionally, some anti-epileptic drug enhances synaptic inhibition by increasing GABAergic transmission, and some anti-epileptic drug works by suppressing excitatory transmission, for instance by decreasing neurotransmitter release or by decreasing synaptic excitation via its action on inotropic glutamate receptors. If you like this video, hit like, and this is the end of the series of videos on the pathophysiology of central nervous system disorders.